So we should be testing for H. pylori certainly in patients who have an ulcer or have had a peptic ulcer at some time in their lives. We should be testing people with a first-degree family relative who's had gastric cancer. And we should be testing in people who have upper abdominal discomfort, so-called dyspepsia. Apart from pure heartburn, where it's less relevant, but in upper abdominal discomfort, we should be testing for H. pylori in younger people at below the age of 60, rather than do an endoscopy. We should be testing and then treating if they're positive. There are some other groups where you ought to be testing, some sort of niche groups, people who've had a gastric malt lymphoma, a rather rare tumor, people with obscure iron deficiency anemia that you can't find a cause for. Certainly if they have H. pylori, you should be treating that. And people with ITP, idiopathic thrombocytopenic purpura, should be tested for H. pylori because there's some benefit in terms of raising their platelet count once H. pylori has been eradicated. And we also should be considering testing H. pylori in populations who we know are at higher risk of gastric cancer. So that's many immigrant groups in the United States, particularly from Southeast Asia and Central America. They have quite a high rate of gastric cancer, and there's probably a role for testing them, even without any symptoms, for H. pylori.